Hello, everyone. Thank you for joining us today. I'm Kim Papich, Director of Communications for WSU Health Sciences. In these unprecedented times, we wanted to bring you together as an opportunity to support one another while we also get some of your questions answered. Thank you to those who submitted questions in advance. Please know that we'll also be pulling questions from the online chat to answer toward the end of the town hall. I want to quickly tell you how today's format will go. We're going to hear from Vice President and Chancellor DeWalt, then briefly from other colleagues. Then I will help facilitate a Q&A with everyone based on your pre-submitted questions. Additionally, at spokane.wsu.edu/COVID-19, we will post a comprehensive FAQ that covers these answers, as well as posting a recording of the town hall. For questions that are specific to a college, keep an eye out for communications from these colleges. Many are hosting their own town halls and updating you frequently via email and other means. So with that, I'm going to hand things over to Vice President and Chancellor Daryl DeWalt.
First, I want to say thank you for joining us today. And thank you to my colleagues who are here to present and to answer questions. These are uncertain times. I wanted to first and foremost let you know that you, your family, your friends, and your colleagues are in my thoughts. This is a stressful time. Many of us feel unsure, uneasy, and unsettled with deviations from our original goals, our plans, and our routines. I hope in sharing some information with you today, it will help some of the worries and the stress that many of you may undoubtedly have. My first priority is the health and safety of our students and our employees. For our students, COVID-19 has introduced a new level of uncertainty and anxiety to your career paths, with virtual classrooms, canceled clinical rotations for some, and postponed graduation ceremonies, just to name a few. In times like this, it's most important to remember why you chose a profession in healthcare and to look for an opportunity to be a positive force in the health of our community. So what do we do now? First, we take care of ourselves at home. Call friends and family to stay connected. Make sure and get some physical activity while practicing your social distancing. Even while we're coming to grips with this new normal, in time, we will get through this. I wanted to talk briefly about the governor's decision to extend stay home, stay healthy. As you're all aware, Governor Jay Inslee has extended the statewide stay home, stay healthy order through May 4th in an effort to combat the spread of COVID-19 in Washington. As a campus and a university, we support this decision. And that leads me to reiterate the current state of our campus. We are still operating under limited physical access, only granted to essential staff and faculty. Again, this is critical as we continue to protect ourselves and our loved ones. In terms of when we're going to come back to campus, we will follow the lead of public health and other officials in terms of our timing and additional needed precautions. There's a very high likelihood that this will be a phased approach and will gradually work our way back to what once we considered normal. We'll share more details with you as soon as we get closer to a return. And while I spoke to the fact that most of our employees are at home and are teleworking, I wanted to acknowledge the outstanding job of our facilities and custodial staff to keep this campus running. They've taken on extra things like deep sanitization and cleaning measures for all of our buildings to ensure that when we do come back on campus, we're safe. And yes, they are my heroes. I'd like to also address the spending and hiring freeze. Many of you have expressed your concerns about this and about the health of our local economies and beyond. It's natural to have these concerns, as we do too. I'm not going to minimize those for you, but here's information about what we do know, and hopefully it will ease your uncertainty a bit and help you in making informed decisions. We have no current plans to lay off or furlough any faculty or staff outside of looking more closely at some of our outside private contracts. Next, there's a justification form and a hiring process for all identified mission critical hires. Those processes have been communicated out to our academic and administrative units. So please check with your local administrative team on how to engage in those processes if you have mission critical hires. Next, the spending slowdown, what that looks like for our campus. Data is being collected and many conversations are taking place in order to quantify the impact of COVID on our campus and system-wide. As budget decisions are made, they will be communicated as quickly as possible. Next, I'd like to talk about commencement. I understand how frustrating it is for our graduates to not be able to participate in a traditional commencement ceremony. This is truly a time when we as faculty, staff, administrators, and students come together and we enjoy the celebration for your achievements. What I can tell you is this: we're doing as much as we can to make this a special celebration for you. So here's what we know. There will be a system-wide virtual celebration on May 9th at 10 a.m., and we will participate in this as a campus. You'll receive information from WSU on these details soon. That celebration will be followed by a WSU Health Sciences specific virtual event in which each graduate from our programs will be recognized. Finally, every graduate on our campus will receive in the mail our version of a graduation in a box. You'll receive more information as soon as we know. What I would say to you is we're also considering and exploring options for August for an in-person commencement ceremony. Please know we value this as an activity that really is a culminating celebration of your achievements. So finally, I'd like to share some hope and positivity. I want to share 2 examples of what I've seen and then invite my colleagues here today with me to share their anecdotes. First, I want to call out and truly acknowledge the graduate students that work with all of us here on this campus. Their strong, positive advocacy regarding safety for themselves and others who work in laboratories and in the field. Thank you, grad students, you've really come through. Next, I want to say thank you to all of those who are in the health systems from this campus who are affiliated with WSU, who are out there serving society as healthcare professionals. Thank you for your activities. For some of you, you're truly in harm's way. I think of my spouse who leaves each day to go to the hospital system and to work. But I think of the many, many people from this campus who voluntarily have stepped up because they care about others and they're serving society. So again, just a robust thank you to you.
Thanks for those words, Daryl. I'll go ahead and ask each of our colleagues to share their brief stories. Can we start with you, Dean Haberman?
Yes, thank you. I want to expand on what Daryl has just said. I want to recognize and thank our students who are continuing their studies while at the same time, many are working on the front lines of this pandemic. Specifically, our RN to BSN students, our Master of Nursing, our Doctorate of Nursing Practice, and our PhD students. Thank you.
Awesome. How about you, Dean Geraltz McLean?
Linda, if you could please unmute.
Absolutely. Mel, I want to say thank you to our students as well as provide a couple of other examples. I have many examples of students, faculty, and staff that are doing the right thing and going above and beyond. But right now, I'd just like to highlight several. Our second year Firm D students answered a call for volunteers by the Spokane Regional Health District to assist with COVID-19 testing at the Spokane Fairgrounds. They teamed up with medical and nursing students in this effort just a couple of weeks ago, so kudos to them. Secondly, on the PhD front, I want to report that our graduate program executed our very first ever Zoom defense. Maddie Brown successfully passed her final defense. And so please congratulate Maddie on this milestone whenever you do see her. And a special congratulations to you, Maddie, from me. And finally, this last weekend, some of our Yakima faculty collaborated with one of our pharmacy alums to compound, bottle, and label 40 liters of hand sanitizer for use at comprehensive healthcare in Yakima. So yes, you heard that right, 40 liters, and way to go, team. So just a couple of examples. Thanks for the opportunity.
Awesome, Linda. Dean Tomkowiak?
Yes. Well, just like pharmacy and nursing, our staff, students and faculty have really stepped up in an amazing way. Just a few stories. Our students have been involved in providing daycare or pet sitting services for frontline healthcare workers, so they can work on the front lines and not worry about the health and safety of their children or their pets. The other thing is we do have clinical faculty that are across the state who are on the front lines, of course, and some of those faculty have actually volunteered to go into hotspots across the nation to give their services where they're needed most.
Awesome. And Laura Hamilton, our area HRS administrator, how about you?
So a lot of the work that we do in HRS is considered private and confidential, but we have had the opportunity to interact with a good number of the faculty and staff over the last few weeks. During that time, I myself have been able to see many of our managers and supervisors refocus their efforts on ideas that allow staff to work remotely, but to continue to support the teams in the best way possible. Just today, we actually had the system-wide HRS team meet, and great fun new ideas of having a hat day while on Zoom, and things that we can continue to have fun and engage with each other in a very difficult time. But really the compassion and the care that I've witnessed during this time that people have for each other has been what's been most uplifting for me personally. And I would encourage everybody to continue to show yourselves and others that you're working with added compassion and understanding during this difficult time.
Thanks, Laura. And finally, Vice Chancellor for Student Affairs, Jim Moore.
As we've been hearing, our students are doing a tremendous job transitioning to online learning and also volunteering in our communities and doing incredible work there. However, they're also doing this while many of them are continuing to struggle themselves. So I wanted to recognize the student leadership team that keeps the campus pantry open. They're coming in on Thursdays, 12:45 to 2:45, so students can still access food, grocery items, and things they need to continue to meet their needs. So I just wanted to recognize that work being done. Thank you.
Awesome. Thank you, everyone. It's so critical to keep these positive stories coming. It really certainly helps to keep my spirits up, and I'm sure the spirits of others. So let's start with some of our pre-submitted questions. Daryl, you already alluded to this a little already, but we did receive a number of inquiries regarding the financial stability of our students, faculty, and staff. Laura, can you address for everyone what you know to be true given assistance for faculty and staff?
Yes, I would be happy to do that, Kim. We do have a lot of unique work and leave options that are available right now because of the current situation. So we've had a lot of questions that have come in around the use of expanded use of sick leave that's available in light of the virus. Because we are a state-funded institution, we are required to follow civil service rules regarding leave, and we're not able to independently approve additional leave. The state, though, has provided the use of sick leave for civil service employees who need to be at home to care for their children because of a school closure, which I know a lot of us are dealing with. The ability to use sick leave due to the school closure has been expanded by the system administration to also allow AP and faculty to utilize sick leave for these purposes as well. The HRS COVID-19 website is being updated pretty much on a daily basis with additional information that is available about changes in emergency rules, it does have an overview of the types of leave that are available to each employee type that they're able to use, which does differ slightly. So at this time, one of the questions that has come up is specifically about the use of administrative leave, and WSU does not have administrative leave. So I would encourage going to the COVID-19 HRS webpage to look at the leave types that are available for your employment type. If employees do need to take leave without pay, the time will be considered time in pay status for leave accruals. So that's another emergency rule that was put into place. Employees who are on leave without pay can also review the Employment Security Department website for additional resources that are available to them during the virus. If employees do need to take any medically related leave, we encourage them to directly contact disability services because the options and resources are changing fairly constantly. New information and guidance is being received again daily. The website's being updated as new rules are put into place. And we're providing guidance to area personnel administrators pretty much on a daily basis to share with their teams. So your local administration is receiving all of those updates. But please, for any specific questions, you can reach out to HRS directly. While we do have staff on site daily, we are engaging in our workplace with appropriate social distancing. So we're happy to meet with anyone via Zoom or via the telephone.
Great, thank you so much, Laura. And then Jim, if you could shed some light on assistance that's been provided to students and resources available to them.
Absolutely, happy to do that, Kim. As we are in a dynamic and evolving situation, Student Affairs has developed a website to help students keep track of services and changes that might be happening. So they can visit spokane.wsu.edu/student affairs, and then they can click on the appropriate link for Spokane or Yakima, depending on where they are. And on there, you can find resources around the academic library, computer loan program, academic support services, internet access, along with many other items. One of those I want to draw attention to is the emergency funding that is available there. We have some limited dollars made available for our currently enrolled health sciences students. And so for students who are experiencing a financial hardship related to COVID-19, I strongly encourage them to submit an application. We have also been hearing from people who want to make a donation to help our students. The foundation has set up a Cougs Help Cougs program, and for people who are able, these donations will support students and can be made at the foundation website at foundation.wsu.edu/student-support. Click on the WSU Health Sciences Spokane option, and the funds will support all of our students, Spokane, Yakima, or wherever they happen to be placed. I'm also making today a pledge to match every dollar donated to the Chancellor's Excellence Fund up to $2,000. So I strongly encourage anyone who can give any amount, whether it's $1, $25, $50 or more. Please give, as our students are in need. As I previously mentioned, the campus pantry is open, so I encourage students to take advantage of that on Thursdays. We also recognize that this is a stressful time for students. So our counselors are still available via HIPAA compliant Zoom or via phone. You can set up an appointment through the website and their email. The Diversity Center has also established a virtual diversity center where students can drop in and talk with other students or staff. So I strongly encourage students to take advantage of that. That's happening Monday through Friday, so it's a good resource. So just ending on, our Student Affairs team is still accessible via email, phone, or Zoom, and we look forward to assisting our students be successful during this trying time. Thank you, Kim.
Very cool, Jim. I want to make sure everybody caught that was Jim making a personal acknowledgement that he would be matching funds up to $2,000. So that's really cool. I also had a chance to visit in the virtual diversity center the other day, and I really enjoyed the camaraderie that I found there, and I encourage everybody to visit there. So a reminder again that we're currently accepting questions on the chat. We just covered resources for students from a financial perspective, but many of you are curious about how students are doing with their transition to online learning and resources in that regard. So Dean Gerolds-McLean, can you address for the group how your students are doing and resources that you're aware of for all students?
Absolutely, Kim. Thank you. We know that our pharmacy students are very similar to medicine and nursing students as well, in that they've embraced the transition to online learning, and they're actually performing quite well, as are the faculty who are making all of these opportunities available, supported by staff as well. From a recent campus survey, we know that on a scale of 1 to 5, with 1 being poor and 5 being good, in terms of connectivity and access to education, our students are rating themselves at about a 4. Now, we also don't want everyone out there to forget about a laptop loaner program that's being offered out of Pullman, and parking lot Wi-Fi connectivity should you need it. So identify the right people in your college to be able to get more information about either of these services. The area where students are telling us that it's a little bit harder on them is their environments not being conducive to learning, with only about 60% of our respondents indicating that they're in an environment that is quiet and supports their learning needs. We know that there are some challenges out there for you. First and foremost, though, it's important that our students be at home. We know that. This is meant to protect you. And so even though there are some challenges associated with some of those environments, we know that that's the best place for you to be. So be at home. In the meantime, WSU is asking faculty to be as flexible as possible, and think about some of the connectivity that's being available in the parking lot. Maybe that'll help you. Reach out to your faculty or advisor or college leadership for assistance, or student affairs. But I would like to just personally say thank you to each and every one of you who are out there listening. You've done a great job. You've worked with your faculty. Keep it up.
Awesome, I echo that. So what lies beyond for the end of the semester? Dean Tomkowiak, the medical school is probably most unique in terms of learning during the summer. Can you address for us how this might look for your areas and for students generally after the semester's over?
Well, sure. Certainly the COVID situation has changed the learning environment for all the health science colleges. And I think the principles by which we are all operating are numerous, but I just wanted to elucidate 3 or 4 of them that are affecting the way our students are engaging in the upcoming months. First of all, we're all thinking about our students' well-being and safety, and that's a large consideration. The second is the effect that this is having on their progression in their studies, and we all want them to complete their degrees in a timely way and be successful. The third is thinking about how our accreditors are thinking about the situation and what they would like us to do with our students. And then fourth is a consideration of local, state, and federal government, and what their wishes are in terms of staying at home or not. And so when you put all those things together, each college has a little bit different circumstances when it comes to our students and what they're doing. But I think at the end of the day, we are all listening to those 4 things and making decisions based on that. Having said that, for students who are not currently engaged in clinical environments, we're making sure that we have plenty of other ways in which they can learn about clinical reasoning and how to take care of patients in clinical environments. And for those of us who still have students in clinical situations, we're making sure that they are as protected as possible in order to get the work done. Certainly, in terms of the medical school, we run sort of year round, and we have students engage in activities all the time. And so that's going to be no different this summer, except that our students are going to be engaged in more of a virtual environment for us for the time being. And again, that's different from college to college.
Cool. Yeah, a reminder again that we know that the several areas that Dean Tomkowiak just talked about are very different for each college. So please defer to your colleges. We're also putting links available online, and we'll have our FAQs where you can direct back to the college as well. Several of those areas and several questions that we received about our learners and their current place in the healthcare workforce. I think Mel, maybe you could answer for us. We know that many people internally and externally have asked about the possibility of graduating students early or alternatives we can explore for online clinical learning. Dean Haberman, can you tell us about what's been happening in the College of Nursing?
Yes, thank you, Kim. So across the board, our 3 colleges agree that it is not feasible to graduate our learners early, despite the opportunities we've been given to do so across the state. But we appreciate the need behind these requests. In the College of Nursing, we're exploring other ways in which we can help with this workforce shortage. For instance, with our RN refresher program, we are currently petitioning the State Department of Health to allow us to offer online clinical training so that we can reestablish these RNs in practice. These are nurses that are already practicing, but they're now doing a refresher program to come back into the workforce. And although all of our colleges have been careful in our messaging to students about their volunteer activities, we do know that a number of students on their own time and of their own volition have been dedicating a tremendous amount of time to their communities and various medical efforts. This is the type of ethic that is at the core of every COOG nurse, and we remain extremely proud of our students. Thank you.
As you were talking, Mel, my mind went toward how our students are involved in the COVID response. And I know many people are curious about how our researchers are involved in the response. I know we received a lot of those questions. Daryl, can you address for us what role our researchers are playing in COVID-19 and any guidance or potential financial impacts that you know of specific to those endeavors?
Certainly, Kim, but what I might do is just remind people that research is critical to our mission. It's part of what we do as a land grant institution, and our health sciences colleges are very active in research. They identify challenges and problems, and then they bring potential and real solutions to those challenges. And this is a situation that we're seeing in real time. I want to remind folks that the collective community of researchers, that is the students, the staff, and the faculty for the health sciences, it exceeds $30 million a year in expenditures. That's a huge amount of organization and of work and commitment and dedication. Also want to mention to folks, this is increasing rapidly. And over just the last several years, we see a doubling over the last several years of this research activity. So what does that mean for us? Number one, we already have folks who are doing COVID-related research. There are folks across our colleges who are looking at the epidemiology of this terrible disease. There are folks who are doing some of the basic biology related to the disease. So we have a team that's already doing things that are related to COVID. And what we're doing actively as an institution is looking how we respond to this health crisis. So there's a tremendous amount of activity, but I'm going to shift a little bit and talk about some of the concerns that people have had. First, we've had folks who have asked about the safety of doing the current research activities. And we've had to make the hard decisions to cease the clinical research activities, especially the clinical trials. We've halted those for now, and we're looking for opportunities when we can go ahead and reignite those activities. In addition, our laboratory-based research, we've had to prioritize safety of all the colleagues in those environments, and we are exercising that safety. So there has been a slowdown of those research activities. Now, what does it mean in the future? Well, the institution is cognizant of the challenges that this is providing to many of our highly successful students, faculty, and staff as they do their research activities. We're aware of that. We take it seriously. It's a constant, I dare say, an every day and sometimes an every hour conversation about how WSU responds to COVID. Here are a few guiding principles. We want to be about solutions in these very trying times. Our research is part of the solution. So I want to say thank you to all of you who work so hard. I have an understanding of your commitment to research as a former researcher. So thanks for what you're doing. Please be patient with us as we try to understand how to work with the federal and state and local agencies in regard to the continuity of the research activities. Yes, there's a slowdown, even for some a halt right now, but we're looking forward to when we will be able to restart a lot of those activities, and we will communicate that to you as soon as we possibly can. I would also say we're aware of the budget implications. Think about our health sciences and the great trajectory of the research. $30 million a year, that's jobs, that's great discoveries. We understand that this COVID challenge is impacting you and your research. And we are active in trying to understand how to address that and try to help you continue those activities. I would ask, please, stay in touch with your associate deans for research, your vice dean of research, the vice chancellor of research. Let them know about the challenges that you're having, and they will be part of the leading effort to help you in the current situation and then to help you get things started again. So I think I'll just leave it at that, but I do want people to understand how much we see and appreciate their great efforts and the great research that they do.
Thank you, Daryl. I want to remind everyone again that we are currently taking questions on the chat, and we do have quite a few out there. I'm going to start addressing some of those. I've got kind of a multifaceted one that I'm going to give to you, Laura. It's really around how are we keeping essential employees safe, and anything you know to be true about how employees are using their time, the non-essential ones, specifically for training. Are there any restrictions on the amount of time that can be used for training? And if you can remember this one, I'll remind you if you need it. Can we donate sick leave to colleagues who need it for childcare?
Thank you for all of those questions. So the first one, specific to essential workers and protective equipment, we are working very closely, especially for our custodial staff who are in the buildings and doing cleaning, to ensure that they have all of the adequate protective equipment that is being issued daily. We have ample amounts of protective equipment in stock. If there is anyone who does not feel that they're being provided with the protective equipment necessary for the work that they're doing, we do ask that they reach out to HRS so that we can work with leadership and make sure that all of that's being provided. But in working with our executive over facilities, I know that that's being very proactively offered and made available to our essential staff who are still on campus. With respect to the use of training time, that's a question that has come up quite a bit because, as you know, in our business policies and procedures, it talks about the 96 hours that are available a year for staff to engage in learning activities. Those learning activities are activities that we as employees choose ourselves to engage in. So if we have a leader or a supervisor who is asking us to engage in activities that's directly related to the work that we're responsible to do for the university, that doesn't go into that 96 hours of time. So there is a much more broad amount of time that's being offered, especially in light of what we're all facing, for people to engage in learning and development opportunities. And if you go to the training website, I believe it was just today, there was an update added at the top of the website that provides a broad amount of opportunities for people to engage in Skillsoft training, and there's an Excel worksheet that was actually added that actually has other free learning and development opportunities that, as supervisors are working with their teams on what the best learning experiences they can engage in during this time are, all of those resources are there, and it's being updated as we have new opportunities that we're able to identify that are no cost to the university. Finally, with respect to shared leave, so donating sick leave time for employees who may have needs for childcare because of the virus. There has been an expansion of shared leave by the state. Again, those rules, because we're state funded, are set by them. And so the shared leave program has been expanded to cover COVID-19. So if you are a manager of an individual who has been impacted and you would like to look at the use of shared leave, the policy is on the HRS website. You can engage in the application process, which would include communication out to members of the team to solicit donations for that.
Awesome, you remembered all three. Good job, Laura. So Jim, I'll try to keep my next question more simple for you, so it's not you don't have to remember three of them. I'm going to group a group of questions into one area and just ask about refunds overall. So Jim, can you share with us, what do you know about any refunds or tuition or assistance for students or staff and faculty?
Absolutely. I think first, one of the things I want to do is commend the faculty and staff who've been doing a tremendous job to keep everything going and functioning. Our faculty especially have done an amazing job moving their curriculum to being an online experience. And our students are also rising to become online learners. And I also want to recognize that there did have to be some advocacy for adapting the curriculum to be presented in that way. And that we have been able to maintain the excellence associated with the educational experience. Having said that, as education continues, tuition and fees, there will not be reimbursement for those items. However, for the parking fee, if you're on the Spokane campus, there is a prorated refund available, whether you have the annual, semester, or quarterly pass, and that you can find on the spokane.wsu.edu/student affairs site, some of the information you may need, or on the parking site. And that is available for everyone, not just students. I just happen to be referencing our student affairs website.
Awesome. And I don't know which dean maybe wants to take this. Maybe Dean Tomkowiak, since you went a little bit into the area of keeping students protected. We have a couple questions out there about what steps are we taking to keep students safe in their clinical rotations, and then any thoughts yet around when students are coming back to campus, if they have been in clinical rotations, what are our expectations of them in terms of transitioning back to being around their peers?
So I'll say a few words and then maybe let Linda speak to her students, because I know her students are in clinical environments. To the extent that we are making sure that all of our students are trying to abide by the objectives for social distancing, even if they're in clinical environments, to the extent that they can do that. We've certainly asked them to do that. And that's even true for our students in advice that we've given them in terms of volunteerism. We want to make sure that no matter what environment they are, that at least as for the College of Medicine, when we are ready to return our students to a clinical environment, we don't want anything impeding them from being able to engage as soon as possible. And so that means, being ready to get into that environment, which means decreasing their chance of exposure to the greatest extent possible. The other thing I think we need to think about is sort of all those factors that led to decisions around how students are engaging or not engaging in the clinical environment are the same kinds of factors that we're going to be considering as they re-engage into those clinical environments. So looking at the global sort of political landscape of recommendations from the federal, state, and local governments, and then thinking about the university recommendations, health science campus recommendations, and then all those other considerations. Certainly, even if we can get to a place where all students are back in clinical environments, the COVID virus is still going to be out there. And so we have to think really carefully about are our students going to be wearing PPE, for example, and do the clinical providers that our students are at, do they have enough PPE for our students to wear? So considerations like that are certainly at the top of all of our minds. Linda, I don't know if you want to share a few more words.
Sure. Many of our students are on clinical rotations right now. We have students in their final block of clinical rotations, so our fourth year professional pharmacy students, and we have asked them to follow their systems, policies, and procedures. So they are doing everything that the hospital or the ambulatory site is asking for them to do. They're simply following policies and procedures. With regard to individuals who are displaced, so for example, a health system is no longer able to welcome a clinical rotation student, our students are working with their experiential education team as well as our chairs to make sure that that opportunity for learning continues so that competencies can be met. And we're doing a good job of handling that. So it's, as Dr. White calls it, it's a hybrid model right now, and we're taking it one day at a time.
Cool. Thank you both. I think we have time for one more question and then some closing comments from Daryl. Laura, back to you. I know that there was a recommendation that came out this week around masks and some new guidance. Can you give us some interpretation for how WSU is interpreting those recommendations?
So right now, the guidance that we're receiving from the CDC is really specific to when individuals are in settings where social distancing might not be as easy. So settings as being in the grocery store and being around individuals who you may not have that 6-foot span of distance with, or waiting at a pharmacy for medications, things of that nature. Where WSU really has engaged in an essential staffing model, the majority of the interactions that we have are not going to meet those guideline requirements that have currently been set by the CDC. But we do know that those guidelines are changing on a frequent basis based on new information that they have available. So at this point in time, if there is a need and you're on campus and do not have the ability to have an appropriate social distancing with individuals, certainly work with your leadership to ensure that you have the appropriate protective equipment available. Again, our facilities has done a fantastic job of ensuring that we do have the appropriate level of equipment available to individuals on campus who have those needs. So please make sure you're engaging in those conversations if there is a need that arises.
Awesome, great. Well, I want to respect everyone's time today, so let's end things with some final thoughts from Daryl.
So thank you, Kim, but I want to reach out right now in real time because I can't engage with you directly, and thank Dean Tomkowiak, Dean Haberman, Dean Gerolds McLean, Vice Chancellor Moore, Director Hamilton, and Kim, thank you very much for orchestrating this. We hope that for those who have listened in today, those who have asked questions, that this is beneficial. These are hard times. They will be hard times for the foreseeable future. But I'm inspired by the leaders I just thanked. I'm inspired by others. And so I'm going to make a couple suggestions. One person who inspires me greatly is Steve Gleason. And many of you have been able to see that behind me is a Team Gleason flag, and it's a no white flags. Steve, even in advanced ALS, each day finds a reason to be thankful and grateful. He's written many tweets recently. As you know, he has to write them with his eyes. And he has said, this too shall pass. But I think more important than that is the spirit that he has of pressing through and making the best of this challenging time. We're going to get through this. I want to end with a quote that I saw on social media. It said, The biggest loss in the end is if we come out on the other side unchanged. So let's all choose to come out on the other side of this better and together. Thank you.
Great words to end with, Daryl. So that concludes our town hall for today. Thank you to our panel. Thank you to those of you who were able to join us and who submitted questions. I want to remind you that you'll be able to find a recorded version of this town hall and a list of the questions with answers on our COVID-19 page at spokane.wsu.edu. And finally, I want to remind you that President Schultz and the WSU system will host another town hall this Friday, April 10th at 11 a.m. on YouTube. Hope you are there. Otherwise, take care.